This is the C4 podcast, or whatever the heck we're going to call this thing. We're here with COO extraordinaire Ian Gershman and our CEO, Jonathan DiCarlo, and myself, Christopher Bennett. Welcome back. And so we are diving in today to some random idea, trend, topic. Who the heck knows? That's kind of what's beautiful about our time together. But I think our supreme leader, Jonathan DiCarlo, has something for us to talk about today. What are we talking about, Jonathan?
Today, we're going to talk about forecasting. This time of year and every year in January and February, firms across industries put out their annual forecast. What are the topics? What are the trends? What are the things that people should be paying attention to? And in particular, in behavioral health, those get really fascinating and interesting because it's not just marketing content that those firms are putting out, but it's their real lead indicators of what people should be paying attention to and can be paying attention to as they go through, say, this year, 2024.
Didn't you say you just checked out the McKinsey outlook on this?
I did. I was just reading a 2024 forecast from McKinsey, and there were some really interesting pieces on that. You know, issues of reimbursement, issues having to do with specialty pharmacy, lots of really interesting content and direction within it. And I thought for the behavioral health field, it was a super fascinating look from a trusted expert and trusted resource in the world. But I also thought it was short and not targeted enough to be useful.
So as you often say, Jonathan, and then Ian, he's so quiet. He's not really quiet, so he's going to speak up for sure. But you often say a lot of people want a really simple answer to a really complex topic. Sounds like McKinsey might be trying to hook up a simple answer to a little more complexity.
Well, I think so. They're trying to tackle some large dynamics and make them accessible in ways that are helpful. But they focus, for example, on payers within Medicare and within healthcare systems, focusing on a general term like outpatient settings, such as physicians' offices and ambulatory surgery centers, where truthfully in behavioral health, most of what people are looking at in 2024 is going to be the expansion and the utilization of mental health outpatient, for example. So I think they're trying to take something that is complex and make it accessible, but quite frankly, leading people down a path that is a bit of a chasing a rabbit around my backyard kind of experience.
Yeah, I think when you look at the Kinsey report, you see that there's, again, it is very broad in the areas that they're identifying. And what's really important for organizations to do is to see, like, does that fit within the context? Because if I'm a for-profit, out-of-network program, the idea of embracing Medicare is so far out from me. It doesn't mean it's not necessarily possible to do, but it's so far out from my context that it's always important when you look at these kind of projections out across like the next time frame and what's going to become operant. It's important to see that within the context of the organization that might be seeking help to do something related to that. So, again, when you look at, and I think what we can do is we come from both ends. We can say, you have a primary care practice. Here's how you could add on to it some quality behavioral health programs. And on the flip side, I know that what we've been talking about for a lot of years is how do we integrate? How do we bring primary health care back into a system where we're treating people for behavioral health challenges and still make sure that they're getting that? And so there is a system that does that. It's called the Federally Qualified Health Center. But again, if you're a for-profit, either using in-network contracts or out-of-network contracts, it's a different kind of vertical, if you like, to get over to that to be able to provide those services.
I mean, one of the things that the McKinsey report points out is that there's going to be a growth pacing of government, funded programming and public health options that's going to exceed the commercial space by a particular percentage. And they give a good breakdown as to how that arrives. But I think it's really challenging, and you really kind of need to be a macroeconomic expert to understand how, as an individual business, am I going to use that information to inform the decision that I'm going to make on a local level, right? And I think that's where that complex to simple detail really comes in. It's like, should I be looking at taking on Medicaid as part of my payer mix? and being able to look at that with thoughtfulness and feasibility and say, well, what are the implications and what are the benefits, and how does that help my business serve more people? How does it inform the services that I have? Those kinds of considerations.
Yeah, it makes sense.
And so so the structure that does that is a strategic plan, because I would say my experience has been that a lot of executives come and say, well, I think I should do this because it seems to be, it's a trend that's coming forward, like Medicaid. Wow, maybe we should see if we can tap that. And I generally have to talk to those executives and say, hey, can we just cycle back for a second or zoom up and out a little bit to see like what are the targets in your strategic plan? Because if this is not part of the plan and it's not been shared with your group, and people aren't on board with this, it's going to be a significant shift for you in terms of the culture of your organization and what you're doing. And there should be some planning that goes around in front of that, so everybody knows like the pathway that they're headed in.
Yeah, I mean, I was speaking to one of our clients today about a launch protocol for them as we set their launch date with them for their new outpatient services, and talked about starting, when do we start the Medicaid service line, in particular in their payer mix, and had a really defined conversation, both from the economics, but more so from the culture and the service delivery perspective of how does this fit into their strategic plan? Because it was there, but we want to push the timeline of adding Medicaid service to their portfolio sooner, much sooner. And the owner asked a really great question as our client and said, should I do that from the very beginning or not? And so we walked through that strategic evaluation process with him during the call. And it was really great because he had said, I have an understanding of Medicaid, and most of the people that I talk to in behavioral health, when I bring it up, they sort of shy back a little bit because they have misperception about it.
Right.
And so I think there's, being thoughtful about that and really understanding. And we walked through some of the details and where do people's, misinformation come from? What are the facts? What are the things that we need to consider, as we move forward in, reattuning their strategic plan alignment to bring Medicaid in sooner in the market that they're launching in.
So again, really interesting, because I've had quite the opposite experience today, working with a clinical director COO who isn't really aware of the chief executive's goals for expansion over the next 120 days, has a vague idea about it. But again, what we were discussing was, is there a plan to drive forward the structure of where we want to get to 120 to 180 days from now? And her answer was no. And that's part of the leadership work I'm doing with this staff member, to bring her into that sense of like, how do we plan what we're doing to go forward, as opposed to it just being like, oh, we should do that. We should do that. Like, let's pursue it. Let's go after it. When it's not fully aligned with what's actually happening in the organization. And for them, it had to do with less, again, the vision, but does some of the data support moving in that direction for that organization? And again, so I go back and say, strategic planning supported by data is really important in any initiative you would go. And I just want to give you another really interesting example. I mean, for me here at C4, I'm always driven to helping to provide, to helping organizations integrate medication-assisted treatment into their services. And so with this organization, we followed national trends. We believe that opiates, as we know, opiate use is on the rise. Overdoses continue to be on the rise, despite all the inroads we've made towards providing access to medication. And what we found after we established these beautiful protocols and fabulous pathways for opiate users to receive MAT, we discovered that actually we don't think the geography supports that as a major kind of service line for them, because we're not seeing those patients. They're heading somewhere else at the moment. So it gives us kind of two pathways to go in, but without the planning underneath that, again, sometimes it's just we're throwing darts at things and we're making decisions based on global things we know without looking specifically at the context of the organization and the geographic location and what their opportunities are in terms of bringing either a new service line on or a new type of patient on or something like that.
Sure. I mean, it's interesting because I have not read the McKinsey report. It just showed up today. And so I'm tracking with the both of you, but it seems like there's a pretty strong sense of things around intentionality, right? It's like really easy to look at like the shiny object and like, oh, there's Medicaid and that's what we need to do, or medication assisted treatment. And all these people are overdosing. And so we've got to like just get a MAT program like immediately going because this is happening and we have to, serve our community in this way. But it sounds like from two different angles, which is fascinating, but hearing the idea of intentionality, slow down, take in the information, plan, strategy, data, and then look at making decisions, which makes a lot of sense. But I think it's one thing when you also see a branded McKinsey report, there's a big name, a big brand. It's like Apple puts out a new phone and you don't look at it, you just go buy it because you think that it's good. So it could be perceived by a lot of people, I'm sure, that, oh, McKinsey said this, like it must be true. So we should just go do that.
Well, I think it brings up an interesting perspective, Chris. And I think some people, want to believe this to be true. But a lesson that I was taught by my grandfather as a young boy was, if you're making investment decisions without information, they call that gambling. Right. That was his insight. He was an immigrant.
Sure.
He was an immigrant who came, from Italy to the US and learned and lived through the Depression and was able to build a business and be reasonably successful and, gain trust in his community and taught us very practical economic lessons as a child. And he said, if you're making uninformed decisions, that's called gambling. He's like, if you're just guessing, even if you're using your gut. So not, it's one thing to have a trusted report from anyone, even our information about forecasts. It's like, question, ask for the details, engage, but make sure you understand the information rather than just assuming, as you said, a big brand puts out a product, you just go buy it because you're supposed to, they're an established, trusted brand. Validate the sources, look at the sourcing. It's one of the things that we share with all our clients. Even in our feasibility reports, we always list the sources where we can of information so people can learn how to trust that. One of my favorite things and favorite topics these days to help clarify for people is measurement-based care and outcome tracking. And so when people quote all these studies and things like that, a lot of them don't actually read the source material of the studies. They read that abstract description you get on PubMed or Google Scholar, and then start quoting the article without reading the primary sources of the article to say, well, what did the study actually say? And what does it mean? And if I don't know what it means, can I find someone to help me interpret that? That is a trustworthy source. So, for me, when I look at that, I don't like to gamble. I like to make really well-informed decisions, but not, analyze to paralyze decisions, but to gather as much valid information as possible and then make informed decisions. Because I can't tell you how many times, and this should make you all smile, we get calls where somebody calls up and says, so-and-so told me I could do really well in behavioral health if I did X, Y, and Z, name the service line. And I could do really well and I'm really profitable. And again, I go back to this call I had this morning with a client. And he said, I can't talk to my one friend who's an investor. And he said, IOP. But then I start asking him detailed questions and he has no idea how short-term his vision is. So when I talk to you, Jonathan, and you validate a longer-term strategy for me with data, I trust you more, right? Because it's about making an informed decision. And I think there's huge value to teaching people how to access that information and giving it to them. Hence, just this discussion in and of itself, right? It's great to ask questions, and you should ask questions. But it's learning how to accept the answers you get and then ask better questions.
So,
yeah. Sorry, go ahead, Chris. I was just piggybacking.
You go, and I'm going to circle to something. So go ahead.
I do think it's important to ask questions. I also think in a planning phase, especially when I'm looking to go in a direction, and just again zooming out a little bit more. In addition to the data, I also, again, in my example, I have to be careful about my own bias, right? So I have a bias. I believe that medication is an extremely important and effective part of treatment, but I have to be aware of, how culturally, how my organization supports that, and do I have the infrastructure to execute that kind of component in my treatment program as well, if I wish to grow in that direction. I also am a big believer in, there's a well-known movie called The Verdict with Paul Newman, written by the great American playwright David Mamet. And there's a sequence where he goes into the courtroom and he asks a question without having done the work, without having looked it up, and he gets the wrong answer. He gets an answer that's really not good for him and for his client. And when he comes back to the office, he's shaking his head, and the old lawyer says to him, "Never ask a question you don't already know the answer to." And so, again, I think it's that notion of, it's not just like a visionary thing. I want to be sure that I've explored all the questions that are going to come up before I, again, take that next step to move towards whatever that next first step is, towards execution. But in that sort of discovery, analysis, evaluation stage, I really want to, with a very open mind, ask loads of questions and put those answers down to determine whether this is a viable opportunity. And again, for me, I think what we do very well is we answer the questions from both ends. We answer the question from a conceptual point of view. Is it relational? Does it fit within the construct of the organization? And then we also come in and say, like, okay, great. So the organization feels very confident that it wants to drive its way into a Medicare-based population, which we know right now is actually a very viable pathway to both increase revenue for services and a really underrepresented population in behavioral health, really a population that's being left behind, not just with mental health, but also with substance use as well. And so again, I think if the organization decides like it can do this, then you start to look at like, how would we do this? And it fits within our culture. So what are like the granular pieces that we need to put in place to be able to execute this? And then very simple questions sometimes, like, can we afford to do that?
Right. Well, thank you for bringing it back, Ian, to the idea of opportunity. And so I want to circle back that we started this call really talking about 24 and forecasting into 24. And we went down the road of obviously what McKinsey's put out and things like that. But I would love, call it 2.5 minutes from each of you on what do you see? Like, what is the 24 forecast? Jonathan, give me the simple answer to a complex question, my friend.
In the 24 forecast, I'm going to zero in, and we have some material being published currently on that. And so I'm going to skip a few of the ones that are probably expected, and I'm going to focus on one really particular one, and that's marketing and business development. And I'm going to focus on the fact that we have an entire generation of business development and marketing representatives in several sectors, substance use and mental health treatment, that have had a lot of constraints because of pre-pandemic and pandemic conditions of being able to effectively market. And we've had an increase of utilization and leveraging, digital media marketing efforts. But I think one of the forecasts in 24 is it is wise for businesses to reinvest in strengthening their relational marketing. If you're going to look for growth, do not overinvest in digital alone. Really invest in diversifying your relational marketing with your business development teams to stabilize things going forward, because that's where you're going to have the greatest traction, because there's a whole generation that only knows how to market to each other, meaning other BD reps just marketing to each other, as opposed to having, legacy opportunities and mentors that really know how to help them develop diversified access points into communities to build their referral base. And it's a huge concern because there is an entire generation, that really struggles with being able to do that. I can't tell you how many times I talk to people, especially in the last 6 months, where they say, oh, when it comes to marketing to hospital EDs, emergency departments, it's a black box. I don't know how to do it, or unions or big employment groups. And it's like, that's the question is, are you asking the right questions to the right people and getting to the right people who are trying to solve those on those employer sides or on those hospital sides to find other providers? Those are the types of questions. So I think relational marketing is a thing for people to invest in, watch, and grow in 2024, and that it's going to have the most direct impact on their businesses. Over relying on digital is going to be a downfall for many, or at least a challenge for them in not getting the results they're looking for growth-wise of treating and serving the people they want to continue to treat in a different way.
Look, I thought you were going to take that in a lot of directions. That is not where I thought you were going to take that. So amazing. I mean, makes complete sense. And of course, it's definitely a part of what's going on. And I did the little, kind of example, right, of like balance the scale, because there are so many people that have just been dumping cash into digital. And then if you have relationships with the digital marketing companies, they're kind of like putting their hands up. They're like, look, we can't do it all, right? Like, someone can pay us as much as you want and put as much of a PPC budget together, an ad budget, right? All of this stuff. But like, we have limitations. Like, this is a part of a marketing strategy, not the whole thing. And the people that we, and I'll say collectively, we have seen be really successful in the utilization of digital marketing efforts have been the ones that also have relational marketing efforts, because it balances the scale. And so when digital is down and leads are down from PPC or ads or this, the relational's up, right? And the vice versa. And so it's this nicely balanced scale. So thank you, Jonathan. Again, just an interesting one to focus on, the relational marketing element. So I'm curious, Ian, what do you see?
Yeah, for me, I suppose I could come up with a list of many things, but the first thing that evokes for me when you ask that question is two pieces, somewhat at sort of opposite ends of maybe the tolerance scale. The first one is the integration of primary care. And for me, this is just a quality of care and quality of life pathway for people. And that zooms out to something that's still part of it, which is what's the pathway for people into treatment, and how are we working with people who are, I know the term is harm reductive, but how are we working with people who struggle with ambivalence and can't actually enter into the funnels that the large portion of our industry has, which is funneling into the highest level of care to begin with, and then there are other dynamics that go on. So for me, there are many, many benefits to the integration of primary care into substance use treatment. So that would be my first thing. And then, unless we've been living under a rock, we know that depending on the state, the use of psychedelics in addiction and behavioral health medicine, it's there for us. And so what I've always encouraged people to do over the last year is not to say, oh, yes, we embrace that, but to let's have a conversation. Let's have a discussion, because there are certain things we can't say aren't true. So for me, it's about opening up the conversation to our traditional settings to say, how can we manage this? Because we're going to have clients that are going to come to us either asking to do this, or they're going to come to us saying, I have done this, and now I'm in your IOP program, right? I just did a ceremony over here with something, and I want to talk about this in this setting here. For me, those are the two things. Physical health is vital and important. I think has always been, for certainly in our settings where it is for profit, out of network, or even some of the in-network contracts, we don't focus on it as much. Again, there is a model that exists. It's a federally qualified health center model, and they do fold all of those components into the care of people. And really, again, I suppose if I was to say, is to think a little bit about what does it really mean to meet people where they're at? What's that really, really mean for you as an organization?
I'm going to throw one last one in there.
All right, you got 30 seconds.
I took two, so he has to have two.
Well, the last one really is before you start to look to technology or new technologies to solve a problem you may or may not actually have, ensure that the technology you're already paying for is leveraged to 80% or better capacity utilization of the services you're already paying for. Most providers, and I have tons of great examples, have systems that they're only using 10 to 20% of. So before you go looking to AI to fix something or add another software service, make sure you're at 80% utilization across your entire organization and culturally attuned to using the technologies you have before you go spend additional or look for other solutions.
Great point. Yeah,
that's my last one.
Well, there we go. Jonathan Carlo, Ian Gershman, breaking it down for 2024. Thanks for joining us today, and we will see you all next time.